We work in lymphoma, that's the focus of my lab. Well, of course we want to find cures for cancer, right? We will settle with controlling it for the lifetime of a patient, and ideally patients just die of old age, and that's acceptable. Patients live with those diseases for a long time, but if we can eradicate it, it's obviously better than telling someone that we can't cure their cancer. So this is a strategy that's quite aggressive, and the goal here is to eradicate tumor cells. The Harrington project concerns targeting a translation factor that we think is very important in cancer and also in viral diseases. Translation factor has a name, it's called EIF4A. This translation factor is needed to make a subset of proteins that are very important in cancer, MYC being maybe the most important one. Cancers are really addicted to it, more than any normal tissue. Most cells in your body that are not proliferating, they don't have MYC at all. Cells in your body that have MYC are, for example, your bone marrow cells that are proliferating, that are growing. They also depend on it, but there is a difference. If in cancer you get rid of MYC, cancer cells die. Your bone marrow cells, they just stop growing, and they pick it up again once the MYC is back. So you have this window of opportunity where cancers are really addicted to it more than any normal tissue. Aggressive childhood cancers like medulloblastomas, neuroblastoma, T-cell leukemia. Those are childhood cancers. They're driven by MYC, very aggressive diseases. That's what MYC does. In adults, it's lymphomas, small cell lung cancer. That's specifically driven by amplifications of that MYC gene. Where does it go from here? How do we make a safe way of delivering these drugs? How do we bring it to the clinic? How do we bring it to patients? And there are two ways of doing it. You can have just a pure compound, and it's going to have a narrow therapeutic index. The other way is, can we target it? Can we attach it to an antibody and deliver it selectively to the tumor? And that's what we're doing right now. And we think that's a way to increase the activity on the tumor and reduce the toxicity in a patient. So the Harrington contribution really has been some amount of funding and connections to great advisors who are knowledgeable about drug development. I'm not. I am a doctor by training. I've transformed into a scientist, but I'm not a drug development expert. You can only wear so many hats. And so getting that advice is very, very helpful.